Hi, I'm Dr. LaQuandra Nesbitt, Director of Louisville Metro's Department of Public Health and Wellness. In America, 105 people take their lives by suicide each and every day. And while murder deaths capture the headlines, there are far more deaths by suicide. There were 103 suicide deaths in Louisville in 2011, compared to 51 murders. Our suicide death rates are higher than both the state and the nation. Suicide occurs in virtually every Louisville neighborhood among both men and women of all ages. On today's show, we'll learn what each of us can do to help prevent suicide and what resources are available. We'll talk to Jan Ulrich, the Suicide Prevention Coordinator for the Kentucky Department of Behavioral Health, about prevention efforts throughout the state. We'll talk to Dr. Carol Montgomery of the Jefferson County Public Schools about what Jcps is doing to guard our young people against suicide. And finally, we'll talk to Geneva Robinson of 7 County Services. She'll tell us about the 24-hour Hope Now hotline and other services. All that and more when we come back. Joining me now is Jan Ulrich, Suicide Prevention Coordinator in the Kentucky Department for Behavioral Health. Welcome to Health Matters, Jan.
Thank you. Glad to be here.
Today we're going to talk about a topic that some people may be very uncomfortable talking about, primarily because we just don't have a lot of conversations about suicide in our communities. Can you tell us a little bit about what some of the common myths are around suicide?
There are a lot of myths when it comes to the issue of suicide, and I think these myths keep us from doing everything that we can do to protect our loved ones that might be in crisis. One myth is that you can't do anything to stop someone who might be at risk of suicide, and that's just not true. Suicide is really one of the most preventable kinds of death. Another myth is, well, people who are serious about suicide don't actually talk about it, and that those people that do talk about it, they don't really mean it, they're trying to get attention. But in fact, many people do come out and tell someone that they're thinking about suicide, either directly or indirectly, even often as much as a week in advance. Mm-hmm. And so we have to take those things seriously. And the other myth is that the only people that can prevent suicide would be behavioral health professionals. But in fact, the person that's most likely to be able to most immediately recognize the signs and help someone get to help is going to be someone that they already know. So those are some of the big myths around suicide.
So we talk a lot in our community, and you touched on it a little bit earlier, about preventable causes of death, right? So we look at between 15 and 34-year-olds, for the 15 to 34-year-old age group, I apologize, in our community, the top 3 things that they're going to die from are suicide, homicide, and unintentional injuries. And so for us, we embrace this notion of it being preventable as well. So let's talk about that a little bit more. How prevalent is suicide locally or in the state of Kentucky?
Well, I'll go first to the national. If we look at the national picture, we lose about 38,000 people to suicide every year. And we know that number is actually lower than it actually is, because many suicide deaths go down as something else. In Kentucky, we lose around 600 people to suicide every year, and locally, I believe it's give or take a few people, but around 100 people every year. And so, when we look at it from that perspective, back in 2009, for the first time ever, and the same holds true for the following year, suicide deaths actually outnumber the deaths by motor vehicle fatalities.
We all embrace the notion of wearing a seatbelt and car safety, vehicle safety, teaching people how to use the streets when they're pedestrians in the same way as we teach people how to use the streets when they're drivers, but we're overlooking some of the critical causes of death in our community, as well as when it relates to suicide. If we were to tell some of our viewers sort of the things they should be looking for with families, family members or friends or even colleagues and coworkers that may be showing some signs, what would those signs be for an individual to look out for?
Well, maybe a little different depending upon whether you're talking about a child, a youth, or whether you're talking about an adult. But we do know that there are various different verbal clues that somebody may come out to say. As I said a little bit earlier, if someone starts talking about how, you know, pretty soon you're not going to have to worry about me anymore, or you'd be better off without me, or they may come out and say, you know, I just might as well kill myself. They might be that direct. Those, of course, would be very obvious signs. And we see, especially with young people, we start seeing those messages show up on Facebook, on Twitter, or texting. You know, quite often when I've gone to a school community where there's been a young person that's died by suicide, they have made that communication electronically, and most often it's the youth on the other side that see it first, and if they don't know what to do and how important it is to get a trusted adult involved, they may let it go until it's too late. Sometimes people will go through behavioral clues if they've made an attempt in the past, if they're dealing with issues of depression, in particular if there are signs of hopelessness. Mm-hmm. The hopelessness is very, very important in dealing with someone that might be thinking about suicide, feeling like they're on a burden to their family or to their friends, feeling like they're a failure, somebody that has maybe gone through an extremely embarrassing situation, someone that's gone through some sort of a physical, sexual, emotional assault. You know, in particular, those that have gone through very traumatizing events of any sort. And then we can also look at situational clues. We sometimes call these triggering events that may be the last thing that happens before someone actually starts thinking about suicide or makes a suicide attempt. And it could be a loss of a job, it could be a breakup in a relationship, it could be a fear of getting in trouble or incarceration, or maybe they've been kicked out of school, or, you know, those type things that are very, very traumatic to them. But suicide is very, very complicated, and so it's not as easy to say, like almost any other public health situation that we look at. You can't just fix one thing and that takes care of it. But if you think of it as being like a glass of water filled all the way to the top, and then one more drop on top, and it begins to overflow. That's often where people are at when they're dealing with thinking about suicide or going to make a suicide attempt. This has happened, and this has happened, and this has happened, and then that one last thing, and it gets beyond their ability to cope. Mm-hmm. And at that point in time, they can't see outside of the blinders of the psychological pain that they're dealing with.
You mentioned suicide and suicide attempts. Now, when I was in medical school, we used to, learn women have more unsuccessful attempts before they're successful. Men are more likely to be successful on first attempt. Men are more likely to use violent means such as firearms. Women are not. Do we still see those same trends now, or are we noticing anything different?
We went through a short period of time where we were starting to see women use more firearms, but that didn't consistently stay in place. But for the most part, you know, you rarely have a second chance if a firearm is instantly accessible to someone who is extremely depressed, you know, and in crisis, or whatever that crisis may be. And so finding ways, I know it's hard to bring this into the picture because it can be very volatile, but looking at how do we not have the firearm in the hands of someone who is in a crisis at that point in time. And it's not the same conversation as do people have a right to own firearms. It's not the same conversation. It's how do we do a better job of keeping them, you know, keeping somebody in crisis from being able to instantly access something that is going to end their life. Whereas back, as you were saying, women tend to, it doesn't mean that they're less intent on dying, but they may go to a means that they may be more comfortable with.
You've been a wealth of information for us today. Is there anything else you'd like to share with our viewers in terms of suicide prevention, things that we could be on the lookout amongst our loved ones and our colleagues and friends, or any other things we should be noticing or paying attention to as a community as it relates to trends?
Well, I think when we look at the issue of suicide, it's much more far-reaching than maybe we think it may be, because someone who is hurting psychologically so badly that they're thinking about ending their life, they're not necessarily going to be making good choices. And so they may be taking risks physically. They might be taking those risks in a car and not wearing a seatbelt and driving at 90 miles an hour. If you don't care if you're going to live or die, you know, it affects things. If you are in a situation that you don't want to be the one that pulls the trigger, but you want to die, there are some people that will put themselves in a position that a police officer ends up being the one to shoot them, which is not only the trauma for the person that dies, but that's a lifetime trauma on that police officer as well. Looking at the type of health choices that people make when, you know, sexually risky behavior, other types of risky behavior that we look at from that public health perspective. When you don't care, when you hurt so badly that you don't care if you want to live or die, then you don't make good choices. So this has a very far-reaching effect.
We want to thank you so much for joining us today here on Health Matters, Jan. And up next, we're going to hear from Jefferson County Public Schools about things that we're doing locally to protect our youth. With us now is Dr. Carol Montgomery, Assistant Superintendent for Academic Support Programs with Jefferson County Public School System. Thanks for being on Health Matters with us today, Dr. Montgomery. For some of our viewers who may be wondering, why is JCPS part of this discussion? What is it that they have to do with suicide? Why is this even on their radar?
A lot of people think we're all about testing. They think we're all about achievement. They think we're all about these test scores. And they see us pushing reading and writing and arithmetic and just trying so hard to make each and every child career and college ready that they forget that we have other goals in JCPS. We care about the whole child, and we want each child to be healthy, well-adjusted, happy. We want them to be safe in a safe environment. But when you're thinking about basic skills, you can't teach them, you can't feed them, and you can't make them happy if they're not alive. And when I started into counseling in the 1970s, that was the very first thing that hit me. I was spending a lot of time working with kids on all kinds of things, and then it hit me. If they're not alive, it doesn't do any good if I work with them on study skills. It doesn't do any good if I work with them on how to be a better reader. If they don't want to live, if they don't have the hope to see another day, then we lose them.
One of the things that I've had the opportunity to work with a lot of senior leaders in the JCPS system here is making sure we always talk about this connection between education and health. And one of the things that we do here is we make sure when we're talking about health, people understand we mean not just physical health, but mental health, emotional health, and social well-being. And so these things are very well aligned. As you mentioned, you can't really do the reading, writing, and arithmetic if you're not dealing with the stressors of life, and in fact, as you've mentioned, if you're not alive to do so. Can you tell us a little bit about the JCPS Prepare program?
It's becoming a little bit famous around the state because a lot of times when you start talking about suicide prevention and crisis training and how to get schools ready for any eventuality if there was a crisis of any type, with a shooter, with a suicide, with a terrorist, with just any kind of emergency. A lot of times school administrators and school teachers and even the parents would wing it. That's what we call it. They would wing it. They would just do what came naturally, and some of them had better plans than others. They would all make safety plans, but some of them would hold water and others wouldn't. And so what we found just a couple of years ago was a nationally recognized program for training and preparation, and it is called Prepare. And it's all about the prevention. It's about assessing where you are with your safety and your crisis management plans in many areas, not just suicide prevention, but many areas. And then it's evaluating what you're doing and then beefing it up. We do have certified trainers in Jefferson County. We want the whole team that works with the children to be ready for any eventuality. We are now being called to go out around the state and help do trainer of trainers so that other school systems can get something of this quality in place in their school system.
We talk about these issues of equity all the time, right? And it's not just good enough for one place to have access to a great resource and not others. So we appreciate, and I'm sure the rest of the state appreciates, the leadership that you all are showing in making sure that regardless of what system our kids are being educated in, they're getting the best of all resources. So that's a little bit about how the school staff can prepare to deal with a crisis or an emergency or an issue. Are there any activities ongoing with JCPS that address with the students issues related to suicide prevention?
Not too many years ago, our legislators had the wisdom to enact a law that said that all secondary students from middle school and high school age, so in our system that is 6th, 7th, and 8th, and then for high school it's 9th, 10th, 11th, and 12th, will have a suicide lesson every year. It's a law. And so we do comply with that state law, and we do a suicide lesson every year for 6th through 12th. And we also have a staff training component that is 2 hours every year that middle school and high school must comply with to be ready to know how to deal with the students, how to teach them, and how to respond to them effectively in the area of suicide prevention. We have found through research that students will most often tell another student when they're thinking of contemplating or completing suicide. And so the Save a Life is a brochure that we give to our students, and it also is useful for the parents and for the teachers and any adult that's in the community. It's very, very useful because it does have many things to look for and many helps in it. We started thinking, but what about the elementary students? There are children in elementary that do think about harming themselves. Sometimes they just think about cutting themselves or knocking their head against a wall, or they think about running out into traffic on purpose. But sometimes they really do want to die. And I personally have met with some of those students that really do want to die. We do not go into every classroom and talk to every child, but we do it on request. On request of the parent, on request of the teacher, on request of the administrator. We are able to go in with people who are used to dealing with children on the topic of suicide prevention. It's very highly tied to depression, so we do have kids that get very sad, they get very withdrawn, they get very confused or stressed out. They quit sleeping. Sometimes they quit eating. We notice changes in their behavior. There's many indicators that go together. Sometimes one is enough to get a parent's attention or a teacher's attention, and sometimes there's more than one that's needed to get the attention of the parents or the teachers. But our children are often crying out for help from us, and we don't want to lose them at any age.
During the time that I've been listening to you speak, we have resources in place for the students, both for them to deal with their own issues, but to recognize how to support peers. We have information for parents on how to identify and support their students and who to ask for and go to help for in the system, the school system, to be supportive of them. And also looking at anyone who may touch the child's life in that school system, giving them the resources they need to be prepared. And we think that's sort of the best way to get this message of prevention out there.
Absolutely. There's one more for parents, if I could share it with you. We use this in our communities. We use this in our churches. We have JCPS counselors, and we have computer support people. We have people that have been trained across JCPS in all different roles that go out and give up their time in churches, and they go out again into any community group like JCs, Lions Clubs, PTA meetings after school. They train the parents after schools. We go to rest homes because you know the elderly is one of our faster growing groups too in suicide prevention.
So we want to thank you so much for being here with us, Dr. Montgomery, and sharing with us all of the great things that are happening at JCPS.
You're so welcome.
And making sure that everyone knows that you can be a resource for them to go to as it relates to suicide prevention in our school systems. And up next, we'll talk about local resources for suicide prevention. Joining me now is Geneva Robinson, Clinical Supervisor for the Hope Now Hotline at 7 County Services. Geneva, we want to thank you so much for joining us here on Health Matters today.
Thank you for having me.
So today's weather's gorgeous, absolutely gorgeous outside. We're in the 80s, it's blue skies, had a little rain earlier today. And so most people think about with longer days, warmer weather, more sunshine, our concerns about suicide should begin to diminish. That's something for the gray days of winter. Is that true?
It would seem to make sense, you think about it in that way, but actually the opposite is true. We actually have a peak in suicide rates during the springtime. During the months of April and the months of May are when we usually have the highest rates of suicide.
What's the thought process behind that?
There's not a definitive answer necessarily, but one of the things that they think is at play here is spring is a time for most of us of new beginnings, of a fresh start. You see the blooming flowers and the trees. And if you're not feeling fresh yourself, if you're not feeling sunny, you're feeling depressed, you can begin to feel like you are very much out of step with the world. You know, and for people who are already feeling isolation, who are already feeling perhaps that they don't belong, that they're not like other people, that can exacerbate those feelings and make them feel even more hopeless about their situation.
Are there any things that we could notice as being a pattern or a series of life events that people might experience that could predispose them or make them at greater risk, so to speak, for suicide?
There are risk factors that we know make people more likely, or their characteristics that make them more likely to carry through on a suicide attempt. The most prevalent of that would be someone who suffers from a mental disorder, usually undiagnosed and definitely untreated. And the number one diagnosis would be depression. Of course, not everyone who suffers from depression kills themselves, thankfully. However, researchers have found that about 90% of the time that people die by suicide, they had an untreated mental health disorder, and depression is the prevalent one. We also can look at people who have had exposure to the suicide death of a parent or a family member, someone close to them. We know that they're more highly disposed to make an attempt themselves over their lifetime. They may have seen that as an acceptable option for dealing with their problems. That's been modeled for them. Folks who have exposure to other types of violence in the home, be it sexual abuse or physical abuse, observing the violence of perhaps a mother toward a father, any of those kinds of traumatic events can make it more likely that someone will follow through on an attempt.
I'm hearing this theme of family. We often think about families as sort of being the protectors or the people to first seek help. Is there a way for a family member to do some outreach on the behalf of a relative or a loved one who they think may be at risk for suicide?
Absolutely. One of the most important things to keep in mind is that it's just important to be aware of the warning signs, to be aware that there are characteristics that make someone more prevalent to hurt themselves. And what a family member or a friend or a coworker, anyone can do that's probably the most important thing of all is to take it seriously when they see these warning signs and to be willing to approach and talk to the person about the topic of suicide. There is so much stigma in our society still about talking about mental health issues, about talking about suicide. It's very difficult for a person who is in pain to be the one to first bring that up. And so if others in their community and their environment can be comfortable enough to make a safe environment and to ask them directly, you know, I'm concerned about you. Are you thinking about killing yourself? Are you having thoughts about suicide? Bring that topic right out. It's a myth that a lot of people hold that if you mention suicide, you might put an idea in their head to try it. And that is absolutely not true. If you've seen enough red flags or warning signs to be concerned yourself, then that is something that is not going to be the first time that they've thought about it either.
Tell us a little bit about Hope Now Hotline. You're the clinical supervisor. It's a good resource here in our community. Share with us a little bit about the program.
The Hope Now Hotline is a program of 7 county services, and 7 counties is our community mental health provider for our region. But the hotline itself is actually available to anyone throughout the state of Kentucky. And it is a 24-hour, 7-day-a-week, we never close, crisis and suicide prevention and intervention line that folks can call at any time and talk to a trained counselor, someone who specifically knows assessment, to determine what the lethality or risk of death is for someone. They'll immediately be talking to a counselor who's had that training. The services that we offer are all free. They're confidential. And a lot of times people will utilize a hotline situation who would never go and talk to somebody in person because of that anonymity. However, we have mechanisms in place that if a person is at immediate risk, we can initiate what we call active rescue, and that's get help to them. If they can't keep themselves safe, we make sure that they're able to be safe as often as we can.
What I'm hearing that everybody needs to hear is this is a free resource. You don't think about whether or not you have insurance or whether or not you can pay for services. This is something we're committed to in our community, that if a person is in crisis and they need help and support, they make this phone call and you trigger all of the resources that they would need.
Absolutely, and we're part even of a larger network, the National Suicide Prevention Lifeline. It's a one number, 1-800-273-TALK. Folks can call from anywhere in the United States, and they will be connected to the nearest available crisis counselor to their area. And that also expands services because there is a special provision on that line for folks who call who are military veterans or the families of veterans. When they call the line, they'll be asked to press a certain number that will connect them directly to a center that has specific training in dealing with issues that pertain to military families as well.
Right.
We also have language interpretive services, so that folks who speak other languages, English is not their first language, both through that national hotline and the local hotline can receive services as well.
Are there any other prevention resources available in our community that we should think about? This hotline is more, it's prevention in terms of people are thinking about it, they may be in crisis and they have an immediate or emergent need. What kind of other prevention resources are available?
We actually hope people will call us even sometimes before it gets to the point where they're in that urgent need, because you know, we can use a database that we have where we can look up from literally thousands of entries of referral resources for folks that we can connect them with counseling. We can, regardless again of ability to pay, or we can connect them with support groups. One of the support groups we work with a lot is survivors of suicide, those who have lost someone they care about to death by suicide. And those folks are hurting and at higher risk as well. So we can offer support groups and referrals for those folks so that their feelings are dealt with too, in an environment that they're comfortable in. But we can also help people get in to see a counselor. 7 Counties has an intake division that we work closely with, who will talk to anyone who is concerned about themselves or someone else, get an idea of what their needs are, and then match them with the most appropriate resource to meet those needs. If it's 7 counties, that's great, they'll make an appointment, but it may be another provider in the community, and they will refer the person to whatever is going to best meet their needs.
Anything else, Geneva, you'd like to share with us today about prevention or the hotline?
We want people to know also that you can call if you're concerned about someone else. You know, if you see a family member, a friend, a coworker, a lot of times we aren't really comfortable dealing with that, but we know we want to get help. So if you're not able to ask that question, are you thinking about suicide, call us and let us make a call out to the person and help you to do that. So those services are available to anybody.
Well, thank you so much, Geneva, for being with us here today on Health Matters. Well, that's our show for today. Remember, suicide, like other forms of violence, is preventable. It does not have to happen. If you feel like you just can't go on, please, please get some help. And if you know of someone whom you suspect may be entertaining suicidal thoughts, please make sure they get the help they need. The number for the 24-hour HOPE hotline is 589-4313. Again, that's 589-4313. Let's all do our part to reach out to those who may be experiencing depression and despair. Do it because your health matters.